So there's evidence from the clinic, and it's called clinical endocannabinoid deficiency. And so it's been discussed, in several papers in the mid 2000s, and then it has kind of come back in the last few years, where patients who have chronic migraine, as well as patients who fit the definition of medication overuse headache, so those patients who are taking chronic medications, it's not necessarily that they're overusing them, so it's a little bit of a misnomer, have lower circulating levels of what we call endocannabinoid lipids. And so specifically these lipids are what we call anandamide or AEA, as well as 2-arachidonyl glycerol, also called 2-AG. And so really the premise of the work came from this idea that patients who have chronic migraine, medication overuse headache, as well as 2 other functional pain disorders, fibromyalgia, as well as irritable bowel syndromes, have lower levels in their plasma, as well as in their cerebrospinal fluid as compared to healthy controls. And so this phenomena persists regardless of sex, but it is definitely more prevalent in females. And that's probably a reflection of the epidemiology of migraine, just in general, right? And so the lab was really focused on understanding, what is the role of the endocannabinoid system in migraine, because it's not necessarily proof, this observation that they have lower circulating levels, that is actually contributing to the disease state itself. And so that's kind of the significance from that standpoint. So what we did was we looked within the total endocannabinoid system. So the observation was with these 2 lipid mediators, AEA and 2-AG, but the endocannabinoid system is more than that, right? And so these 2 lipid mediators are synthesized as well as degraded by specific enzymes for each arm. So when we talk about the endocannabinoid system, we talk about the anandamide arm and then the 2-AG arm. And there's been a lot of work. So now if we kind of come back to that original question, what is the significance of the endocannabinoid system? There's been a lot of preclinical work as well as some clinical trials ongoing with the anandamide arm. So looking at these enzymes, in particular, the degradative enzymes for anandamide, which is the fatty acid aminohydrolase or FA. And, really looking at that as a drug target. My lab was focused on this other arm, the 2-AG arm, specifically because the circulating levels, both in the CSF as well as in the plasma of 2-AG, are 200-fold higher than that of anandamide. Okay, so that's that. So we have lipids, we have the enzymes that make and then break down those lipids, and then we have these proteins that are called G-protein coupled receptors. They're on the surface of the cells, and there are 2 of these, and they're called the CB1 and CB2 receptors, so cannabinoid 1 and cannabinoid 2. And each one of those receptors are expressed throughout the body, including in the central nervous system, the peripheral nervous system, and the immune cells. But they have preferential distribution. So we typically think of CB1 receptors as much higher within the central nervous system, and these CB2 receptors higher in the periphery.